Hi, I'm Dr. Jeffrey Senall, and I'm one of the foot and ankle specialists. Today I'm going to talk about forefoot pain. When we talk about forefoot pain, we're referring to the area of the foot that is in the ball of the foot. Most people consider that the ball of the foot, and a lot of patients will come in with complaints of pain in this area. When we look at the foot, we have the forefoot, which is made up of the metatarsals and the metatarsal phalangeal joints, which are the joints between the metatarsals and the toes. We have the midfoot and the hindfoot, and we're going to concentrate on the forefoot today. Probably the most common cause of forefoot pain is what we call metatarsalgia. And metatarsalgia just means that people are having pain underneath the metatarsal bones. Often they'll complain of pain with walking. Sometimes they'll have calluses underneath the forefoot and pain with prolonged standing. A second cause of forefoot pain is what we call metatarsal phalangeal joint synovitis, and that's referring to the joints in the foot. Metatarsal phalangeal joint synovitis is a condition that people will describe as, again, pain in the ball of the foot, swelling in the foot. Sometimes they complain of feeling like there's something bunched up in their shoe, and might be more specific to the second or the third metatarsal phalangeal joint. A lot of times it'll present the same, so they'll just think they're having pain in the foot. The third thing that we often see is a thing called a Morton's neuroma or an interdigital neuroma. And that's a condition where you develop thickening or scar formation around the common digital nerve that comes in between the metatarsals. People will often have more specific pain in between the bones. They can't really tell you exactly where it's coming from, but they'll feel pain in there. Occasionally they'll feel a clicking sensation. And the most distinguishing thing about a neuroma is that oftentimes they'll have nerve-related pain. So they'll have a severe shock-like pain, occasionally that radiates into the toes and causes discomfort. Typically with these Morton's neuromas, people will have pain with shoe wear, and sometimes it's relieved by removing the shoe or rubbing the foot. When we talk about treatment for these, the treatment is relatively similar for all of the above conditions. Typically, we look at the anatomy of the foot, we look at the biomechanics of the foot. A lot of causes of metatarsal pain and metatarsal phalangeal joint synovitis is due to a tight heel cord, believe it or not. People that have tight calf muscles and tight Achilles tendons tend to put more pressure in the ball of the foot. You can imagine if you had a cord attached to your heel like the Achilles and that was tight, every step you take puts more pressure under the ball of the foot. So we really these days are concentrating on the overall biomechanics of the foot and ankle. Other causes can be hammer toes in terms of putting pressure on the metatarsal, and people that have diabetes often can develop hammer toes as well. And the other causes of these are that you can lose fat pad from the forefoot, and that can cause pain too. So the natural padding in the foot is lost over the years. Typically it occurs when you're a little bit older. What we typically do treatment-wise is we address the pressure areas of the foot for all of these. And the most common thing that we use is a thing called a metatarsal pad, which is a felt pad that you can easily place in your shoe, or we often will tell patients to put this on an over-the-counter orthotic. And this is a pad that we would recommend placement in the foot or on the shoe to be put behind the metatarsal bone. So we'll talk to you in the office about that, and we'll tell you we don't want to have you put this directly under the area that hurts because it'll feel like you're walking on something. But we shift this down to the fleshy area of the arch. And what this pad does, when you walk, it elevates the metatarsals and takes pressure off of them. And this works really pretty well. And it takes the pressure off the joints that are involved, it takes pressure off the metatarsals, and we'll often use it for the neuromas as well. Most of this type of problem can be addressed with non-operative treatment. There's other treatments that we often will do if it doesn't improve with the pads. Additionally, we also look at your shoe wear. Many people aren't wearing the appropriate shoes for what activities they're doing. So we often will recommend a stiff supportive shoe that has a rocker bottom sole, something like a New Balance type walking shoe or a rigid shoe or even a hiking shoe that has a stiff sole and a nice supportive bottom. Most of these shoes, we also recommend that they have good cushioning in them and they have a good arch support. Many times that will take your pain away immediately. Other things we often recommend are Achilles stretching exercises, and we will talk to you about that in the office as well. And these are simple exercises you can do at home, and a lot of times that will improve the overload or the pressure in the ball of the foot. The third thing that we sometimes will do in the office will be an injection. And in terms of the metatarsal phalangeal pain, sometimes we'll put a little cortisone shot into the joint, and that will often decrease the inflammation in the joint. For the neuromas, typically we will do an injection if you're not improving with conservative treatment. And that we do for both diagnostic purposes and also for treatment of the problem. The cortisone injection is typically done in between the metatarsal bones. And so during that process, if you have complete pain relief with the anesthetic portion of the injection, that's kind of a diagnostic test that tells us, yes, that's the neuroma, it's not the bone that's hurting you. Surgery is often used as a last resort for all of these problems. In terms of the interdigital neuroma, the surgery is excision of the nerve that bothers you, and the exchange is basically having some numbness in that web space for the pain that you've had. In terms of metatarsal pain or metatarsalgia, typically we'll look at the anatomy again. If there's hammer toes, we may discuss correcting the hammer toe problem. Sometimes the metatarsal's longer than all the other metatarsals, and even though this is a problem you've had for your whole life, at this point in your life the scales have tipped and you're having pressure underneath that. So there's metatarsal shortening procedures, or sometimes we'll simply shave the bottom of the metatarsals off to lessen the force underneath the ball of the foot. Most of the time, as I said, we can avoid surgery for these issues and restore you to your typical normal functioning.